Good afternoon. I'm Susan Polan. I'm the Associate Executive Director for Public Affairs and Advocacy at the American Public Health Association. I want to thank you, those of you who are here today, and those of you who are watching via the web. We really appreciate you joining us today for the National Public Health Week kickoff for 2017. We are very excited that you're here to participate, and I want to talk to you a little bit about APHA and the association and National Public Health Week. But first, I'd like to thank our sponsor of this event today. Walden University is a proud supporter of National Public Health Week, and we appreciate that support. It has allowed us to bring this event to you, and it is a very exciting opportunity. APHA is an organization that focuses on the health of communities. We are really looking at how to make a difference, and we realize that all of the work that many of us are doing to promote health, unfortunately, is getting lost in a lot of the other discussion that is going on, because what we know works, and what we're going to talk about today is what works. We have focused on the idea that we need to create the healthiest nation in one generation. It's not going to be easy, but it's only going to happen if we work together and we work across sectors, and that is the opportunity that we're going to talk about today, to move from that current ranking of 34th internationally in terms of our health, to move up to really realize the potential that we have with the funding that we have available. National Public Health Week is an annual event, and it's the first full week in April, and what it really does is it celebrates public health. It gives us the opportunity to talk about the good work that happens and to share our stories and to celebrate the good work that we do every year. And it also gives us the opportunity to talk to people that don't necessarily know that even though they might be sitting in a sheriff's office, or they're sitting in a business community, or they're sitting in the clergy, they too are doing public health. And this is really our opportunity to have that discussion today. We're looking at that cross-sector collaboration to know that how we can advance this goal of creating the healthiest nation, recognizing public health is not going to be able to do it alone. We need to work with other sectors, and we need to learn from other sectors. And that's really what we're going to talk about today. What are those new pathways that we can develop to create health? Throughout the week of National Public Health Week, we ask that you engage, that you talk about it. As a public health person, you are by nature an advocate. It is what you do. You advocate for people, you advocate for your community, you advocate for the greater good. And that is really what we're asking you to do today. As you're sitting down to dinner with your friends and family tonight, talk about public health, talk about how the work that they're doing, even though they might not think about it that way, really is improving the health of their community, because everything really does impact the health of a community. As public health professionals, we need to develop strategic partnerships, and we hope that all of you who are working in public health and outside public health recognize the value that you bring to each other and do that kind of work today. We hope that you focus on promoting educational and health initiatives in your community and in the world at large. We know what works. We also know that within public health, trying new and different things also work, and we hope that you look at innovative and effective interventions to make a difference. But most importantly, we ask that you join us. APHA, as part of our goal of creating the healthiest nation, is working on creating a social movement, bringing together the public health community with the people who are sitting on this panel, with the people who are focusing on work all across this nation, and really trying to bring together public health and the public to move forward on all the important initiatives that we know work. You can find more information about Generation Public Health on APHA's website, but all we're asking is for you to engage and to take those first steps to make a difference in the people's lives in your community. During the course of this forum, we ask that you take to Twitter and ask questions. You can use the hashtag NPHW to get those questions answered, and we will be sending the questions to the panelists throughout the course of this event. So take advantage of the technology available to you, no matter where you're sitting. We really hope that you use this tool to get your questions into this group, because what you will find is that we have incredibly distinguished panelists who will be able to offer great insight into the things that you are interested in. So the theme of today is working across sectors to create the healthiest nation. And we really are very excited to hear from the panelists, but it is actually my great pleasure to start by introducing Mr. Tom Quaid. Tom is APHA's current president. He has been a long-time member and active leader within the association, and we have been very lucky to have him in a variety of different roles within the association. He's what you dream of in terms of having an APHA leader, somebody who is involved, who is committed, who is smart, and who makes a difference within the association and within its community. So with that, I will turn it over to Mr. Quaid.